My special guest today is Dr. Michael Holick. Dr. Holick established how numerous factors such as seasons, times of the day, skin pigmentation, sunscreen use, and latitude can influence how much vitamin D we can get from the sun. Dr. Holick is the author of 4 books, including The Vitamin D Solution. Dr. Holick is an endocrinologist and professor of medicine, physiology, and biophysics. He's also the director of the Vitamin D Skin and Bone Research Laboratory. He's also the director of the Heliotherapy Light and Skin Research Center, and finally the director of the Ehlers-Danlos Clinic Research Program at Boston University of Medicine. Among his many accomplishments, he identified not only the primary circulating form of vitamin D in the blood, but other forms of vitamin D and their importance on health. Along with others, he helped develop the first clinical assays to measure different forms of vitamin D, guidelines on determining vitamin D deficiency and how to treat it, as well as sensible recommendations for sun exposure. It is a privilege to introduce you to one of the world's leading authorities on vitamin D for your health from birth until death. Let's get to the interview. So if you don't mind, for our audience, letting them know what are the essential things that they need to know about vitamin D supplementation and their bone health.
So vitamin D deficiency causes 2 major problems to the skeleton, one of which I think people may understand, but the other they don't appreciate at all. So when you're vitamin D deficient, you can't absorb calcium from your diet efficiently. Your body cares about your blood calcium more almost than anything else, because your blood calcium controls neuromuscular function as well as most metabolic activities. And so the body keeps your blood calcium in a very tight range, in a normal range. If you're vitamin D deficient, that ionized calcium will go down a little bit. It is picked up by the parathyroid glands that have a calcium sensor and immediately increases the production of parathyroid hormone. Parathyroid hormone then goes to your bones, and it goes to your kidneys as well. It tells the kidneys to increase activation of vitamin D. But if you're vitamin D deficient, that doesn't work very well. But PTH goes to the bone, and it tells bone cells called osteoclasts to become mature. And they then release hydrochloric acid and enzymes to destroy the matrix, putting a hole in your bone. And it releases the calcium to keep your blood calcium normal. So when you're vitamin D deficient, you're constantly gradually removing calcium and matrix from your skeleton. And by putting in that hole in your bone, decreasing bone mineral density leads initially to osteopenia, low bone mass, and then ultimately to osteoporosis.
Now, may I ask a question? Because the mechanism you just described is also a natural mechanism, the bone remodeling, that happens, but maybe not with the PTH precursor. So it sounds like it's accelerating being vitamin D deficient. Am I correct in saying that?
You are. And so, so vitamin D through its active form and PTH,
parathyroid hormone, because people won't.
Parathyroid hormone, interact with osteoblasts and help osteoblast function. But also they then stimulate osteoblasts to make what's called a protein called rank ligand that then binds monocytes, immature cells in your bone marrow, and it induces them to amalgamate to form that multinucleated giant cell known as the osteoclast. And that's what starts to chew up your bone, just like Pac-Men and women, right? They go in and they start chewing up your skeleton, removing calcium and matrix. So that's the first consequence of being vitamin D deficient. But what often is not appreciated is a secondary consequence. When PTH is increased in your blood, it not only tells your osteoclasts to remove calcium from your bones, but it goes to your kidneys and it tells the kidneys to reabsorb the calcium out of the urine and put it back into the blood, which makes good sense. But then it also causes a problem where it causes the loss of phosphate into the urine.
Hmm.
The reason that's important is that everybody thinks that when you're mineralizing bone that you care about your calcium. Well, that's true, but it's just like making concrete. So when you're making concrete, you need the right amount of sand and cement and water to get the proper uh, cement content. And it's the same thing for mineralizing your bone. You need an adequate amount of calcium and an adequate amount of phosphate. And the combination of the two then will mineralize the collagen matrix in your skeleton. But when you're vitamin D deficient and you have what's called secondary hyperparathyroidism, so your PTH is going up, you're losing phosphate. And now your blood phosphate's going down, but your blood calcium is normal, but you have an inadequate calcium phosphate product, and you cannot mineralize the new collagen laid down matrix. The consequence is that that matrix is like jello and it absorbs water. And under your periosteal covering, it'll expand. And so people that are vitamin D deficient have what's called osteomalacia, where it's a mineralization defect of the skeleton. And unlike osteoporosis, where holes are in your bones, does not cause bone pain unless you fracture, osteomalacia is different because what's happening is the hydrated jello underneath your periosteal covering is kind of throbbing. So
Moving.
patients complain of throbbing, aching bone pain. They sit down, they lie down, they have throbbing, aching bone pain in their bones and muscles, but it's really in their bones. It's often misdiagnosed as fibromyalgia, uh, or doctors don't know what to do with it. So then they'll say that this is you're depressed, doctor seeking, um, or chronic fatigue syndrome. But it turns out that it's none of the above. Most of these patients that I saw in my clinic with this diagnosis from rheumatologists and others is that when you give them vitamin D, they can have quite a dramatic improvement in their energy level and the achiness and pains in their bones and muscles that they experience mainly in the wintertime, right? That they think is due to being overworked and because it's raining outside and it's cold. Well, that could all be true, but it's mostly caused by osteomalacia. And the simple fix is to treat these patients with vitamin D.
So from the get-go, this is all an outcome of being vitamin D deficient. Would you mind speaking about how someone determines what their vitamin D level is and what is considered sufficient and deficient these days?
Right. So it's hotly debated. I chaired the Endocrine Society practice guidelines back in 2010, came to recommendations in 2011. And all the members of the committee that I chose were experts in the field of pediatric, adult, and elderly vitamin D and bone related issues. And after reviewing carefully the literature, we concluded that for maximum bone health, for no evidence of osteomalacia, that your blood level needed to be 30 nanograms per ml or higher, which translates into European numbers as 75 nanomoles per liter. The Institute of Medicine and many other government agencies will use 50 nanomoles per liter or 20 nanograms per ml. But in my opinion, that will not completely prevent you from having increase in parathyroid hormone, removal of calcium and matrix from your skeleton, as well as causing osteomalacia. And I can
Okay.
give you, and if you don't mind, an example, right? Because people want to know, well, where do you get this information from? And so a study was done in Germany. This pathologist had 675 healthy German adults, ages 20 to 90 years of age. They died unexpectedly in an accident of some sort.
Okay.
So he obtained a piece of their bone and their blood. And he then looked with what's called histomorphometry, looking very carefully at the structural components of that bone biopsy to look for evidence of osteomalacia.
Hmm.
And he related it to blood levels of 25, concluded that to see no evidence of osteomalacia in the 675 healthy adults, your blood level needed to be 75 nanomoles per liter, i.e., 30 nanograms per ml. And so it was based on that information.
Okay.
And also, PTH levels will continue to decrease as you improve your vitamin D status, and it begins to plateau at around 30 to 40 nanograms per ml. And so it's for those reasons that the Endocrine Society considered that for maximum bone health, you should really be at least 75 nanomoles per liter, 30 nanograms per ml. And probably because of the vagaries of the assays out there, 40 to 60 nanograms per ml, 100 to 150 nanomoles per liter, we consider to be ideal for your bone health.
Okay. And these today, thanks to largely your work, are easily obtained just from getting blood work in your doctor's office, correct?
Correct. But herein lies the problem, is that these assays aren't always available worldwide, and it can be expensive.
Hmm.
And so depending upon your healthcare system, I mean, the assay in the United States for 25-hydroxy vitamin D is around $265.
Wow.
Yeah. And so, but if you have good health care and good insurance, a lot of that's covered. And so my recommendation has been that you don't need to screen everybody, but what you should be doing is being on an adequate intake of vitamin D throughout the entire year. And we've done studies, and many others have done studies, and the Endocrine Society Practice Guidelines Committee recommends infants 400 to 1,000 units a day, children 600 to 1,000 units a day. I believe teenagers should be treated like adults, which is 1,500 to 2,000 units a day. And if you're obese, you need 2 to 3 times more because the vitamin D gets diluted in your body.
Wow. And as you age as an adult, does that change at all?
It does not.
In your 50s or 60s or 70s now?
There's a lot of confusion out there that they said that aging decreases the efficiency of your ability to absorb vitamin D. Not, we did the study and showed that's not true. But what is true is that your skin begins to thin as you age. And so the efficiency of producing vitamin D in your skin is less at 70 than it would be at 20 or 30 years of age. But those studies have been done, and we've done some of them to show if you take elderly, put them outside on a veranda, and expose their legs, for example, and arms to sunlight, you can raise their blood level of 25-hydroxy vitamin D. But again, always recommend vitamin supplementation because, as you noted, time of day, season, latitude, degree of skin pigmentation, you really have to be a hunter-gatherer outside, basically half naked every day, right? Like a Maasai herder, for example, in order to be able to make enough vitamin D.
Because my understanding, largely again from your work, is if you use sunscreen or if you take a shower after you've been in the sun, all those things wash away or don't allow the process of vitamin D to occur. Am I correct?
No.
Oh,
And so,
okay.
which is great. I'm glad that you asked the question. It's ridiculous to suggest that you should not take a bath after being exposed to sunlight.
Okay.
And the reason is that you're making vitamin D in your living cells. You're not making it on the surface of your skin. You cannot wash vitamin D off your skin or from your cells when you're exposed to sunlight. So that is a myth. However, sun protection, sunscreens definitely decrease your ability to make vitamin D in your skin. And it's a simple reason, right? A sunscreen with an SPF of 30 is supposed to absorb 97.5% incident UVB going into your skin. And so as a result, you reduce your ability by 97.5% if you put that sunscreen on properly.
Okay. So just on the skin washing, so if my understanding was it was the interaction of the soap and then the oil on your skin that sort of interfered with the process. So that's not okay. Thank you for
True.
clarifying that for me.
Right.
Okay. Thank
Because it
you.
doesn't make any sense.
Yeah, I guess in my brain, in looking at the process, it started with the skin and then it maybe needed a certain amount of time. And you're saying it's already happened.
So what's happening is it's mainly made, so your epidermis has several layers, right? And it's the basal layer right next to the dermal capillary bed where most of it's made. We had published that some 40 years ago. And so you're making it in living cells right next to your blood system. And so you can't possibly wash this off.
So it's just happening midway.
Right.
Okay. Very good. Thank you.
Yeah, I'm glad that you asked the question because I hear this all the time and it's nonsense, basically.
If you don't mind speaking about skin pigmentation, you mentioned aging skin, but also just colored skin, because that's an issue as well for vitamin D absorption, is it not?
So yeah, so that's people always say vitamin D absorption. So it's production, right?
Production. Okay,
So
sorry.
your melanin is a natural sunscreen, and so a very dark skinned person will have a sun protection factor of maybe 10. So they would have to be outside 10 times longer than me to make the same amount of vitamin D. And that's why people of color living north and south of the equator, right, are at very high risk of vitamin D deficiency. And a very nice study was done in England where they took healthy Caucasian and skin type 4, so typically of Asian extraction, and they exposed them for 6 weeks to stimulated sunlight. And they could show very nicely that the white volunteers raised their blood levels reasonably well, but those with dark skin barely raised them at all.
In terms of producing vitamin D through the skin versus getting it orally, again, and this is just from my past, I understood from a pharmacist in Canada that some people don't do well orally with vitamin D. Their body just tends to not absorb it, ingest it, as well as getting it as they would getting it through the dermis, through the skin. Can you comment on that?
Sure. So first of all, at least in the United States, orange juice is now fortified with vitamin D. And I did the seminal study for Minute Maid that got the approval to be able to do that. And so we've been interested for a long time in understanding what controls vitamin D absorption, right? If you, again, go on the internet and they say you have to have vitamin D supplement with fat, right? A fatty meal. Not true. Vitamin D will be absorbed on its own on an empty stomach because it goes into the small intestine and then micelles, chylomicrons are made. It's absorbed into your lymphatic system, goes up into your superior vena cava, is dumped into your bloodstream and then goes to your liver to get converted to 25-hydroxyvitamin D. However, if you have Crohn's disease, ulcerative colitis, we've done studies to show it markedly reduces your ability to absorb vitamin D. Celiac disease, about 10% of the population have celiac disease, right? Gluten sensitivity. They have a difficult time absorbing vitamin D. So typically when I see patients that I would be vitamin D deficient and I would give them vitamin D and it didn't rise very much, then I would work them up for celiac disease. And often that was the cause.
And then do you have to give them a higher dose orally or suggest that they spend more time in the sunshine?
Well, no, I mean, if you give a higher dose, that'll definitely help.
Okay.
But, and again, longer time in the sun is not necessarily good for you, right? That's why we developed an app called dminder.info, DMINDER.info. It'll tell you anywhere on this planet, basically, when you could begin making vitamin D, how much you make, and it warns you to get out of the sun so you don't get a sunburn. Okay, so sensible sun exposure. But also there's an interesting other concept that we demonstrated, which is that when you take vitamin D orally, it rapidly goes up in your blood and then rapidly comes back down. But when you make it in your skin, it takes a while for it to be released into the bloodstream. So when you make vitamin D in your skin, it lasts 2 to 3 times longer in your body than it does if you take an oral dose.
So then could you comment, now I'm getting a little bit confused because there's so many bone studies that were done over the year where they would send individuals a month's worth of vitamin D or 3 months worth of vitamin D. And there was one where they said, here, consume a year's worth of vitamin D. And you're saying that people are just getting this rapid peak, but there is, so if you could clarify for me, does vitamin D not stay in the fat in your body for some period of time and then gradually decline?
So for sure. But what I'm talking about is just the blood level of vitamin D,
Okay.
right? But you're correct, is that when you ingest vitamin D or make vitamin D in your skin, most of it goes into your body fat and then is released back out. And so that's why here in the United States, I would give my patients 50,000 units of vitamin D every 2 weeks for my elderly patients because they didn't want to take a vitamin D every day. And that worked perfectly fine. So that's equivalent to about 3,300 units a day. And I maintain their blood level in the range of about 40 to 60 nanograms per ml. And we did a study for up to 5 years. So it's not like for a month or 2 or 3. But we published a study for 5 years on this program. Their blood level was in the perfect range with no toxicity.
Do you mind, only because that seems a little high, just based on, I could think of the Calgary study that was done in 2018 on vitamin D and bone quality.
Yep. So you have to look at that study carefully. And I'm not going to go through many of the details, but in my opinion, the study probably needed a little bit more thought behind it. Most studies have shown that improvement in vitamin D status will help to maintain your bone mineral density. It will not decrease it. So why they observe that, I don't think we fully understand, but almost all studies that I've been involved with, vitamin D will help to maintain your bone mass. It will not cause it to decrease.
Okay, so you mentioned the healthy limit of vitamin D. Could you let individuals that are listening know if they get their vitamin D levels checked? Because I've had one client, for instance, who went, okay, I guess I really need lots of vitamin D, and then really took a lot of vitamin D. And so what is the upper limit that people should be careful to not exceed?
Right. So the Endocrine Society again looked at this issue, and we felt that to be on the very safe side, that a level between 30 and 100 nanograms per ml in that range is perfectly fine.
Hmm.
Typically, you don't see vitamin D intoxication until you're above 150 nanograms per ml. So there was, in my opinion, a relatively wide safety range. I personally take 7,000 units every day. My blood level is 72 nanograms per ml. So 100 nanograms per ml is 215 nanomoles per liter.
Okay. Okay. So if you have an individual that has they get it tested, a lot of times individuals might be encouraged to take a little more. Should they just assume that they need to be on that little bit more for life, or do you suggest that individuals get an annual test? I know we're talking costs here, but is there a frequency at which you recommend that individuals test themselves or have a test done?
Right. So what we typically do, the way I tell my patients is, look, your vitamin D tank is empty. And so if you want to fill it more quickly, is that I put them on 50,000 units once a week for 8 weeks. So that's equivalent to 6,600 units a day. And then I switch them over to 50,000 units every other week, equivalent of 3,300 units a day. And like I said, we published this, and it works perfectly fine, and that your blood level remains stable. So if you want to convince yourself that's true, a year later you can get the blood test again, but you don't need to do it yearly if you're on a stable dose of vitamin D.
And when you mentioned it sounds like an option, either or. Can somebody do it a bit every day, or they could also just do it every 2 weeks?
Right. So you could take it every day, um, or you could take it every 2 weeks. And what we do know is, because again, we've done the studies, is that if you have a person that's vitamin D deficient and then put them on like 2,000 units a day, we know that the blood level will gradually rise of your 25-hydroxy D, and it plateaus at around 6 to 8 weeks, right? And so giving the 50,000 units once a week for 8 weeks is basically the same thing. It just rapidly increases it, and then you can maintain it.
Hmm. Okay. And um, just so that I could correct a mistake that I've been saying to everybody, that make sure that you're taking it with fatty foods. It doesn't matter what they take it with.
Nope. We did the study,
Wow.
and we showed in orange juice, on a piece of toast, or in corn oil, didn't make any difference at all. But more importantly, what was interesting is that one of the reasons people thought that vitamin D is in milk because of the fat, right? But the problem, of course, is that most people drink now skim milk that has no fat.
Mm.
So we asked the question, what is your ability to absorb vitamin D from skim milk versus whole milk? And you'd be shocked at the answer, which is it's better in skim milk than it is in whole fat milk. And the reason is that when you are ingesting whole fat milk, you don't absorb 100% of the fat. Some of it is lost,
Okay.
and the vitamin D sticks with it. It's a
Hmm.
very small difference, but it was curious to me that, yeah, it's a misconception out there. You don't need fat in order to absorb vitamin D. Vitamin D is fat soluble and is perfectly happy on its own.
Okay. So thank you very much for clarifying that for me and thousands of people out there.
Right.
Um,
And another myth out there is that magnesium is important for absorbing vitamin D, and that's nonsense.
does magnesium play a role, though, for osteoporosis if people are trying to increase their calcium?
So magnesium is a very important component. I mean, it's a minor component of your bone, but independently, magnesium actually will have some effect on your parathyroid glands and on enzymes that may be activating vitamin D. So we always recommend, especially elders seem to be more prone to magnesium deficiency, is a magnesium supplement is a reasonable choice, along with a vitamin D supplement. And we haven't really talked about this at all, but you also have to make sure you have adequate calcium intake.
Okay. If you could share anything else that you think we might have forgotten in regards to vitamin D and optimizing bone health, feel free.
Right. So, like I said, vitamin D is critically important from birth until death. And often pregnant women
Hmm.
are vitamin D deficient. And more importantly, they're told that you breastfeed your infant because it provides all the nutritional that you need. There's essentially no vitamin D in human breast milk. So if you give your infant human breast milk as a sole source of nutrition, that infant's bones will not develop as well because that infant will be vitamin D deficient.
I'm feeling very bad as a mother now.
I mean, yeah, I mean, we did
Okay.
studies and Brutalis did studies, we showed.
Um,
And so, but you may ask the question, right? Why is it that there's no vitamin D in breast milk? That doesn't make any sense, right? I mean, why would Mother Nature do that? And
because there
simple,
was sunshine to look after it, I guess.
the simple answer is right, is that our hunter-gatherers were outside every day making thousands of units of vitamin D a day.
Mm.
So a study was done, again, by Bruce Hollis and Carol Wagner in South Carolina. They showed that if you give lactating women 6,400 units of vitamin D a day, they finally put enough in the vitamin D in their milk to satisfy their infant's requirement.
Okay. Well, I did take supplements, so hopefully enough. All right. But thank you, because I do remember reading a study about how the amount of vitamin D in utero even made a difference to the health of the bones at birth. So, and so I take it that is the nutrition of the mother.
It's very important.
Yeah.
Correct. Yes.
Okay. Yes, starting early,
Correct. And then what I always
so
tell
critical.
my younger patients, right? They'll have a bone density that's perfectly normal, say at the age of 25 or 30 years of age, but they have a terrible diet that lacks adequate calcium intake, and also they're more, believe it or not, prone to vitamin D deficiency because they're indoors all the time, they're working all the time, and so I tell my young patients that what's happening is it's very subtle, is that because you're vitamin D deficient and your PTH is going up even just a little bit, you're constantly removing some calcium from your skeleton. And usually it's about maybe an eighth of a percent. So it's a tiny, tiny amount. But if you multiply an eighth or a quarter of a percent times 30 years, you've lost a significant amount of bone that you should never have lost if you had been on adequate calcium and vitamin D.
Okay.
Right. And then
Very
the final point is exercise. And so for my patients, I would recommend that weight bearing exercise, and particularly walking, 3 to 5 miles a week, the pounding on the pavement translates to your hip and spine and helps to maintain it. So many of my elderly patients with osteoporosis, I would keep on adequate calcium, adequate vitamin D, walk 3 to 5 miles a week, and I could maintain their bone density.
nice. Nice. Well, thank you very much for sharing all that great information and clarifying lots of points that needed to be clarified. So many misconceptions out there. So I do appreciate your knowledge and all of the work that you've done in the area. So thank you
I
so much.
appreciate the ability to be able to share my experience with you and your audience. And yeah, I hope that some of these myths will eventually resolve themselves and no longer be on the internet, because we need to have truth.
Quite agreed. Thank you.
My pleasure. Thank you. Have a good day and have a delightful day.
To learn more about Dr. Holick's websites on vitamin D, go to the description box below. Go here to learn more about critical nutrients for bone health. Thank you for joining me today.